Good afternoon. Thank you. I'm truly honored to be over here. Thank you, sir, for inviting us, inviting our Indian Speech and Hearing Associations, and our president requested me to talk over here, actually. I am Ram Pravesh Kumar, audiologist, speech language pathologist, sir, Dr. Dilip sir, and Dr. Uma ma'am. Spoken a lot about the professional and something similar, like, because I worked in 14 years in USA, and something similar like lagging in India also. And so truly unnoticed speech, language, and hearing problem in India actually, and that's why the problem has been gradually increasing. When you see the WHO statistical, it says that like 1.9 billion actually are suffering from hearing problem. And when you see 2011 census, actually 1.5 million actually suffering in India, having a communication problem and hearing problem. And communication and hearing problem is something, it's not like today I'm talking to you guys, you are just listening to me, and then you will communicate, and then you are hearing it very nicely. This is so important, and it's touching to the heart for everyone actually. We guys deal with hearing problem, even though when the child born actually, then we see them whether their hearings are normal or not. So that's why universal screening tools has been big. Like we guys do hearing screening tools also. So first what we do actually is we do early detections. Early detection is so important, and based on the universal hearing screening, within 0 to 1 month, the child has to be screened. And if the child fail, then within 3 months, actually, the child should get diagnosed. And within 6 months, the child's intervention should start, because developmental of speech also should begin with that actually. So these numbers, now if the child is born actually, and during the premature period, then even there are many departments actually who can collaborate with us. Like nurses is definitely one of the departments, they work closely with us actually, and community workers, and there are many health professionals actually. Even the health professionals also take longer time to refer patient to us. So we guys do, we have advanced equipments, we do autoacoustic emissions, we do behavior observation or audiometry actually, and we screen them with the advanced equipments, we diagnose them actually, and we start the therapy or treatment or amplification as quickly as possible actually. We also deal with adult patients. Most of the adult patients, like stuttering, cluttering, voice problems, and something misarticulation problems. These are the problems also have been increasing, and like youth, most of the youth we are seeing with the sudden hearing loss. Sudden hearing loss can happen anytime, anywhere actually. And the stroke patients nowadays, before within like long back actually, stroke patients can happen only for the genetic based patient actually. Now stroke patients can happen in youth also actually, and they get diagnosed with aphasia, anomic aphasia, like some kind of no, it's called conduction aphasia, Broca's aphasia, Wernicke aphasia. So when we treat them with the speech problem actually, then it takes longer time, and that time also our nurses, community workers, and allied health professionals, and we work together to improve their prognostic skills. And there are varieties of patients with vestibular balancing difficulties. Nowadays is becoming very common actually. Even positional vertigo will have a difficult to sit actually, difficult to do their activities. So we have a very much we are very much instrumental actually. We diagnose whether the problem is in sacral region or ocular region, and based on that we treat them. We also find whether there is a problem in peripheral region, central region actually. So it's kind of like now it's meeting, interacting, and understanding about the problem. And that time, like our communities and nurses or all health allied health professionals and health professional, even what I have seen actually in my life when I came over here, our medical professional also have a very much limited knowledge about our field. So that feels that will improve the improve the overall skills actually, and we can interact. Okay, this guy's having a time out. Okay, so I'm done. Thank you so much. It was pleasure. It was pleasure inviting me. Thanks.